What we're seeing in Italy, we may think from sort of what's happening everywhere else that these seem to be quite severe measures in order to try to control the disease. You've actually had a really good figure just shown there about flattening the curve, and this is why these kinds of measures are being put in place at this point. That what they're trying to do is both delay the peak and reduce the height of the peak, which potentially improves the situation and reduces the pressures on the health service. The challenge with this, when we're putting in control policies, is they might need to be sustained for a significant period of time. So when putting in such measures, it's really important to consider the situation in the country and make sure that they are introduced at the right time so that they can be put in place and continued until they need to be. What I'm suggesting is they need to be introduced at the appropriate time. And this is the difficulty because if you introduce these measures too soon, then it may be that actually they can't be sustained. And of course, if you introduce them too late, then they're too late to really have an effect. And this is why there are an awful lot of discussions going on at governmental level as to when is the appropriate time to introduce these measures so that they have maximum effect. I think every country is in really a different phase. I mean, if you compare, say, the situation in Italy to maybe in the UK, for instance, we would suggest that in the UK, we're maybe about 2 to 3 weeks behind where Italy are in terms of the growth of the cases. So certainly the discussions that are happening here in the UK is that we are potentially moving from containment to delay in that we're starting to see a rise of cases. We're seeing much more human to human transmission happening within the country. And so we're sort of on the cusp of maybe the next 2 to 3 weeks are really crucial from our perspective. And we may start to see the kinds of measures introduced that we have seen in Italy. And we've seen this in other countries, as we've just been talking about. Spain have closed schools in Madrid. So we could start to see a number of these measures come in several countries in Europe over the next couple of weeks. A lot of it is the sort of common sense, good hygiene practices that have been reported, as you say, regular hand washing, trying to avoid touching the face. If you have a cough or sneeze, catch it in a handkerchief and dispose of the handkerchief and then wash your hands, but also maintain distance from other people if you have those conditions. So we've been talking about self-isolating. So if you are in a household where you're infected, maybe sleeping in a different bedroom from others to minimize the risk of infection, and potentially keeping a distance from people who are susceptible. If you are susceptible and you know people who are infected, essentially do the same. Try to keep a distance to reduce the risk of infection.